Good day, everyone, and welcome to the Human Development Zone brought to you by the Education Support Forum. Today we have Adebisi Adenipekun, who is a public health pharmacist and also founder of the Lighthouse Global Health Initiative. He has also been awarded the honor of being the World Contraception Day Ambassador. He is also been awarded by the Bill and Melinda Gates Institute for Population and Reproductive Health as an emerging young leader. And the website 120 Under 40 has also acknowledged the amazing work that he's doing in the health sector. So good day, Adebisi. How are you?
I'm fine, Edgar. Good to be with you here.
Sure. Thank you very much. Finally, we get to speak, and we want to learn about these amazing things that you're doing in the continent of Africa and beyond. So just tell us more. What is the name of your organization, by the way?
Okay, so the name of my organization is Lighthouse Global Health Initiative.
Yes, yes. What do you guys do and how are you guys contributing to the SDGs, the Sustainable Development Goals?
Yes, so we work with vulnerable populations. Specifically, we work with adolescents, we work with girls, we work with women in rural communities and urban slums. We envision a world where vulnerable populations lead healthy and productive lives. And our definition of vulnerability has to do with people who, because of their geographical location, their economic status, their gender, and their age, do not have access to quality health information and services. So based on this definition of vulnerability that we have adopted, we get to work more with women in the rural communities. We get to work more with adolescents, people that they are out of the health insurance coverage, people that do not have the economic wherewithal to get quality health information and services. And what do we do with them? We have a CAP strategy, CARPPS. C stands for capacity building, A stands for advocacy, R stands for research, P stands for public health service, and then the second P stands for partnerships and then service delivery. Wow. So we go to rural communities and implement rural outreaches. For instance, in 2 states in Nigeria, Osun State, which is in the southern region, and then Niger State, which is in the north central region of the state, we implemented rural contraceptive access campaign.
Wow.
With rural contraceptive access campaign, our aim was to ensure that people in rural community understand sexual and reproductive health. They understand that they can actually plan their families. They understand that every pregnancy must be wanted and must be planned for. They understand that because they are married does not mean that they should be giving birth every year. And so with rural contraceptive access campaign, we were able to showcase the realities and stories of people in these rural communities. Do they actually have access to contraceptives? When they have access to contraceptives, is it easy for them to obtain contraceptives? And then from our learning from that project in the first phase, we were able to implement the second phase where we promoted male involvement in family planning. Cumulatively, we were able to reach about 2,000 rural dwellers in both states, and we were able to bring the attention of opinion leaders, policy makers, and even politicians to the realities and the plight of people in rural communities. What we see in these rural communities is that because they have lower level of education and exposure, many of the teenage girls are forced into early marriage. And as soon as they get married at 13, at 14, at 15, the family starts counting down to 9 months to expect that they give birth, and then they have children. Now, these girls are not developed physiologically and psychologically to be mothers. And so, but because of the expectation of the society. They end up having children. Some of them at 21 already have 4 children.
Yes.
And this is one of the reasons why we still have issues of VVF and so many other complications related to pregnancy, and even the high maternal mortality rate in Nigeria and in some other developing countries in Africa. So this is what I do. I work with adolescents, promoting their sexual and reproductive health and finding an integration, a perfect integration between age-appropriate comprehensive sexuality education and their leadership development.
So there have been some development practitioners who have argued that the production of babies by adolescents, especially in Africa, which is leading to the youth bulge, is as a consequence of poverty. So do you think that it would be more effective to tackle the issue of poverty, because there's been quite a number of studies that have shown that there's a correlation between economic status and number of children that people give birth? What do you think?
Yes, you see, the truth is that it's like a vicious cycle. And then so we have poverty, we have level of education directly linked to health status and health seeking behavior and health decision. So if a society has improved economy and the people in the society can afford basic human needs, including education, then they get their mind improved and then they make proper decision. So an effective approach to solving health challenges is to ensure that everyone is economically viable. And this is why we still promote women health and education, because research has shown that when women are empowered, they spend over 90% of their income on their families. Now, but what do we see in many of the African countries, many of the developing nations, is that women are not as empowered as the men. Women do not have equal opportunities as men. So that affects the health of the family, because a woman that is not empowered, that is not educated, does not know the importance of family planning and does not know the importance of breastfeeding. And that's another vicious cycle of a family that is raising a child that is malnourished. A malnourished child cannot perform to the maximum capacity in school. So the malnourished child begins to perform poorly in school. The child that is performing poorly in school gets dropped out of school, and then because the child did not get quality education, the vicious cycle of poverty continues. So an effective strategy is to tackle poverty, but in tackling poverty, we must understand that empowering girls and women is paramount to tackling poverty, especially in rural communities and developing nations. Another approach is to ensure that education is available and affordable for all. And when I mean education, many of the countries, many of the governments in developing nations pride themselves in saying that there's free education. But then how quality is the free education that is available? So we are talking about education that everyone can be proud of. Education that the child of the rich and the child of the poor can, as much as possible, get quality out of that system. So if we have developmental partners tackling poverty, developmental partners tackling education, and developmental partners tackling access to health, because it takes a healthy population to also build the economy. There's no one way approach to fixing many of these developmental issues. We must agree, ab initio, that all of the sustainable development goals are interlinked, and at the center of it all is the empowerment of the girl child.
Nice. No, that's amazing. So, I mean, there's an issue that health practitioners have witnessed across the continent, where we have our belief systems, our myths, our conspiracies, and you find people don't want to take medicine for child for family planning, because there's a conspiracy that they want to eradicate the African population. You know, all those rumor mongering. How do you deal with those kind of mentality across in your work?
Okay, true. The truth is that there are so many myths associated with family planning, and many of these myths are founded on being and baseless, belief, that people come up with to discourage uptake of family planning. But the truth is that let's just narrow it down to families, individual families. For instance, my father has 10 children. And I know the struggle and the pain that he went through, to raise 10 children and to give every one of us education.
Yeah.
As a matter of fact, at the age of 70, when my dad died, he was still working to pay school fees at 70, because he had so many children.
Yeah.
Now, so if we think about it at the level of the family, families will be healthier, we have better options, and we'll be able to live to the fullness of their capacity if the families are smaller.
Yeah.
So if a family has 3 to 4 children or 2 children, they can give those children quality education. The children can end up becoming who they really want to be. And the truth is that African population is a paradox, because we want to keep increasing and multiplying, yet we are not developing our infrastructure, yet we are not improving our health systems. So we end up having large families of people that are adding to the problem of the society, people that are involved in one vice or the other. So it's smart for us. It's smart for us at the family level to ensure that we have the number of children that we can cater for. Forget about someone wants to reduce African population. How many children can you as a father take care of? How many children can you as a father ensure that if something happens and you have to relocate, or you one of the parents loses his or her life, how many children can such a family leave behind, and we'll be sure that the children will be fine? Another way to look at this is the burden on the system. So some people believe that if they have money and they are wealthy, they should have as many children as they want. But the question I ask them is that child going to have a special school? Are those children going to have special hospital? Are those children going to have special road? As long as all of this, are those children going to have special electricity, special health insurance package? As long as everyone that is born, we end up living on the infrastructure that the government is providing, then no family should add extra burden to the government, to the infrastructure that everyone should benefit from. So if you have so much money and you think that you can raise large family, then be your brother's keepers. Have a minimum size of family, so that those that do not have as much as you do can also enjoy the basic amenities of life. Have we asked ourselves this question? That why is it that in Africa we have, for instance, in Nigeria, we have the maternal mortality rate of 814 per 100,000 live birth. Now that is ridiculously high compared to 12 maternal mortality rate of 12 per 100,000 live births in developed nation. So if is it not smart for us to stop losing our wives, our daughters, our sisters, our friends to pregnancy-related complications? So, and one way to avoid that is to embrace family planning. So family planning should not be a political issue. We should not keep fueling the myths around family planning. We should understand family planning, that family planning basically saves lives, saves the lives of our wives and our daughters, saves the lives of the infants and the children, and help us to build a prosperous and healthy nation. If every nation has educated and empowered population, then the nation can actually be prosperous. Maybe this explains why many of the developing countries are actually poor and living on aid from those countries that they think they want to cut their population.
Yeah, that's amazing. That's amazing. Thank you very much for this wonderful and insightful views that you've given us. So I know that you are going to be in Johannesburg this December as part of the Goalkeepers, courtesy of the Bill and Melinda Gates Foundation. So what are your expectations at this gathering, and what are you bringing to the table to edify the meeting?
Yeah, I strongly look forward to meeting other young advocates and leaders across the continent. You know, because one thing we must take note of is the fact that the table is turning and there's a transfer of baton of leadership. And we as the emerging generation must not repeat the mistakes of the generation ahead of us. So we must work together, we must synergize, we must see our continent as one, we must lift our continent out of poverty and all the negative narratives that we currently have. So I look forward to coming to Johannesburg to meet people from young leaders from Uganda, from Kenya, from South Africa, from Nigeria. Let us come together on the table and have a roundtable discussion. How is our continent heading? How are we positioning ourselves for the demographic dividend? How are we responding to the youth bulge, the population of the young people? You know, so those are the kind of expectations I have. Rich conversations with young, smart, innovative minds across Africa. I'll be coming to the conference with a lot of experience from my international exposures and the work that I do at the grassroots.
Wow.
So I'll be blending my experience from the grassroots and international exposure to ensure that we can position Africa, you know, in a better way. You know, Africa is the future. And I strongly believe that Africa is the future. As we move towards the 2030 goal of the United Nations, the global goals, we must ensure that by that 2030, Africa is appropriately positioned to take the lead.
Nice. That's amazing. No, we hope to see you when you come to Johannesburg for the Goalkeepers. Thanks to Bill and Melinda Gates Foundation. Thank you very much, Adebisi. I mean, we could talk the whole day.
Thank you too.
But time doesn't allow. So thank you very much. We really appreciate it. And our listeners will learn one or two things in terms of health, reproductive health, and the need for us to plan our families for prosperity. Thank you very much.
Thank you very much too. See you soon.
Okay, sure. Bye.